Idaho walking back part of its abortion ban isn't a shock when OBGYNs are fleeing the state and hospitals are literally airlifting pregnant patients out because they're not allowed to help them under the state's abortion ban.
This is Theocracy Watch.
Welcome back to Theocracy Watch, where we track how Christian nationalism is sabotaging healthcare so badly, even the hospitals are breaking. Until recently, Idaho law only allowed doctors to act if pregnant people were actively dying, nothing in between, just dying. However, in April, a judge slightly widened the definition so now doctors can step in if there's a non-negligible risk of death. It's a small adjustment made only after 2 years of medical chaos and patient torture. Hospitals have confirmed that lawmakers won't say out loud, Idaho's abortion ban made basic care dangerous. St. Luke's hospital health system reported at least 6 pregnant patients had to be airlifted out of state for emergency care. These cases involved sepsis, ruptured membranes, and hemorrhaging miscarriages that couldn't legally be treated under Idaho law. And the doctors, well, they're done. Since 2022, nearly a quarter of Idaho's OBGYNs have left the state. 6 out of 9 high-risk pregnancy specialists are gone. Rural hospitals have closed maternity wards entirely because they can't keep staff under these conditions. And behind those numbers are stories. Carmen Broder bled for 19 days after a miscarriage because doctors were too afraid to treat her. Jennifer Adkins was told her pregnancy could kill her, but not fast enough to qualify for help. She had to flee Oregon. Desi Ballas got a fatal fetal diagnosis and a warning. Her life was at risk too. Her doctor didn't offer care, just told her to head to Utah. This is what a religiously motivated abortion ban looks like in practice. Medical collapse, human suffering, and silence from the very people who could have stopped it. Collapsing the system is intended, not incidental, because a broken system ensures people stop asking for help and start begging for permission. So until next time, stay curious.
Why are we
letting this? Why would you ever have a medical emergency that you feel as though you would be worried you'd be turned down, Chris?
No, I don't.
Right.
I don't.
I imagine not.
Really...
But when it comes to this particular subject, it's so touchy that there's a possibility we have to give our lives for it. What sense does that make? When you want to build a country, a strong country, that's how you build a strong country? It's going to cost, it is going to cost them far more than they realize. Not just lives.